Welcome to Living Beyond the Invisible, the podcast that explores life with invisible disabilities. I'm your host, Heather, and today we're discussing a condition that affects so many people each year and through a lifetime: congenital heart defects. I am so glad to have you back with me this week. In our first episode, I gave you a bit of an overview of how the podcast will run, as well as some information about me. In today's episode, we are going to spend some time talking about congenital heart defects, what they are and why they are important. This one is very personal for me, as are the next several, but this one is really, really important because it is something that I have lived with my entire life. So let's dive in. Congenital heart defects, or CHDs, are the most common birth defects in the United States, and they vary widely in severity. Every single year, roughly 40,000 babies are born with a CHD of some type. This translates to roughly 1 in 100 babies that are born with a CHD. Now, I don't know about you, but in my mind, in my opinion, that is way too many babies. Even one is way too many, in my opinion, because it's a rough life. CHDs can absolutely be devastating for not only the baby, but the entire family. And I know because I speak from experience. Thankfully, advances in medical care are significantly improving all the time, and they are significantly improving survival rates as well. About 85% of infants born with a CHD now survive into adulthood, compared to only about 20% in the 1950s. When I was born in 1984, my chances of surviving and making it to my first birthday were very low. I don't have an exact percent, but let's just say when I was being transferred from the hospital I was born at to the children's hospital about 25 minutes away, I was given pretty much zero chance of making it between the two hospitals, if that gives you an idea. But on average in the 80s, about 70 to 75% of all babies born with a CHD made it to their first birthday. And a lot of those were ones that were born with a more minor defect. Now, those with defects that were lower and not as severe did have a higher chance of surviving to adulthood. Those of us with severe CHDs only had about a 50% chance of surviving to adulthood, and that was after we made it through our childhood, like our early childhood, like infancy. And I am going to say right now, I am beyond thankful that we have had this many medical advances in the last 40 years. My life expectancy right now is that of someone who is completely healthy. My cardiologist sees no reason that I should not live well into my 80s or 90s. And I'm very thankful for that. I know that CHD is still scary. We are still losing way too many people to it, babies and adults. But we do have a lot of medical advances now that is definitely helping that number to improve. So as you can see by these statistics, there are millions of families in the United States alone that have been affected by CHD in some form or another. I believe there is an estimated 2 million people living in the U.S. with CHD, and that's just in the U.S. alone. But you're probably wondering, what exactly is a CHD and what causes it? Now, I could not find an exact number on how many specific CHDs there are. So I can't give you a number on that, and I can't name them all. But I will cover a few of the more common ones, some that are less severe, some that are very severe. So please remember that this is just a small snippet of defects that are out there. If I don't name one that you know about or you have, Please know I'm not trying to leave those out. But I simply don't have time to go through them all. However, if you would like me to cover a different defect that I don't discuss today, or go into more detail about one that I do mention but don't really dive into, please reach out to me, because I absolutely will do a different episode on that down the road if you want me to. The more common CHDs include ventricular septal defect, or commonly called VSD, atrial septal defect, or commonly called ASD, pulmonary valve stenosis, and I am going to butcher this one because I can never say it right. I know what it is, but I can't say it right. And patent ductus arteriosus, or PDA. Please don't come for me on how I say that. I can never get my words to form correctly. I think it's a brain fog thing, because I used to be able to say it really well. The more severe defects, though, include tetralogy of Fallot, or TOF, which we will be talking about today, transposition of the great arteries, hypoplastic left heart syndrome, and truncus arteriosus. Again, don't come for me. Now, I don't personally know a ton about most of these defects, as they aren't what I have. I do know about TOF and VSD and things like that, because I do have those. But I have learned from various support groups I'm in on Facebook a little bit more. So I do know a little bit about some of these, not a lot. I do also know one thing, though, that CHD is scary, and it is something that is a lifelong battle. Yes, a few of the less severe CHDs can be treated with medication, but most CHDs require surgeries or other procedures soon after birth, as well as throughout their life. They also generally require surgeries or procedures, like I said, as they grow. It's not a one size fits all. It is not a one and done. This is a lifelong thing. CHD is a lifelong battle, and there is no cure. I do want to repeat this. There is no cure for CHD. I've given you some statistics, and I told you a little bit about what CHD is. Let's talk about what causes the defects. The best answer is we don't really have an exact reason. I know that stinks to hear, but it is the truth. Sometimes genetics can play a part in it, and if mom or dad has a CHD, the chances of baby having a CHD goes up significantly. Specifically, studies suggest that the risk of a child being born with a CHD when one parent has the condition ranges from 3 to 50%. That number depends on the type and severity of the defect that the parent has. This risk is significantly higher than a baby being born with a CHD to parents who have no known medical history of CHD. My husband and I have 3 kids together. However, only 2 of those are biologically mine, as we are a blended family. And one big thing while I was pregnant with both of my biological children, we were worried about their heart. I thank God every day that they were both born with a healthy heart. But the risk was there. Moving on, years ago, finding a CHD before birth wasn't something that really happened too often. Medical advances have made it so that CHDs can typically be found now around your 20-week anatomy scan. And if a CHD isn't found, there are now screenings done at birth to help catch CHDs that were missed on ultrasound or an exam. I've told you a little bit about CHD in general. Now let's move on to talking about my history with CHD and how it has affected my life. I mentioned earlier that I was born in 1984, and my mom, who was a single mom, had no prior knowledge that I would have anything wrong with me when I was born. She thought she was going to have a healthy baby. Like I mentioned earlier, back then, ultrasounds weren't as common as they are today, and knowledge of CHDs weren't something that was common either. So I was born right on my due date. I am still very punctual. I do not like being late, and that started at birth, apparently. But at first, everyone thought that I was perfectly healthy. They didn't see outwardly anything wrong with me. I was a little blue, but a lot of them thought it was just because it was cold in the room. My mammal, however, and you will hear me mention my mom and my mammal a lot throughout this podcast. But my mammal was in the delivery room when I was born. She is my mom's mom. And she immediately knew something wasn't quite right. I never pinked up even when she was holding me. So finally, a nurse listened and called my pediatrician, who ordered a few tests and was able to basically diagnose me over the phone based on the test results. The verdict was tetralogy of Fallot with pulmonary atresia. They had no idea how bad it was at that time, and they wouldn't find out until a while later. At the time, my mom and my grandparents were given a 0 chance of me making it from the hospital where I was born to the local children's hospital, like I mentioned earlier. And that is only roughly about 25 minutes away. Depending on traffic, it could be a little more, but with an ambulance, about 25 minutes away. So I mentioned that I was diagnosed with tetralogy of Fallot, or TOF, a couple minutes ago. It is a complex or severe CHD. It is basically 4 heart defects wrapped into one. And I'm going to give you a breakdown of what these defects are, but one of them is actually different for me, and we will touch on that after I break down TOF. So these defects affect the structure of the heart and cause oxygen-poor blood to flow out of the heart and into the rest of the body. The condition itself gets its name from the 4 abnormalities that are present. First up, we have ventricular septal defect, or VSD. It is a hole in the wall of the heart, or the septum, that separates the 2 lower chambers of the heart, or the ventricles. This allows oxygen-poor blood from the right ventricle to mix with oxygen-rich blood in the left ventricle, which is not normal. Up next is pulmonary stenosis. It is a narrowing of the pulmonary valve, or the area below it, which reduces blood flow from the right ventricle to the lungs where it would normally pick up oxygen. And this is the one that is a little different, but I will explain that in a minute. This is just the basic TOF explanation. The next one, or number 3, is right ventricular hypertrophy. That is the thickening of the muscular walls of the right ventricle, which occurs because the right ventricle has to work harder than normal to pump blood through the narrowed pulmonary valve. And finally, we have overriding aorta. The aorta, which is the main artery carrying blood from the heart to the rest of the body. It gets shifted slightly to the right and lies directly above the ventricular septal defect. This position causes the aorta to receive blood from both the right and left ventricle, mixing oxygen-poor blood and oxygen-rich blood. Now, you might remember that I mentioned that I have pulmonary atresia as well. So I also mentioned that pulmonary stenosis was different from me. And basically, having pulmonary atresia means that I do not have pulmonary stenosis. The reason for that is because my pulmonary valve at birth was completely closed. Actually, it was completely absent. But pulmonary atresia can mean that the valve is completely closed or absent. And like I said, for me, it was absent, which then prevents the blood from flowing from the right ventricle to the lungs. This means that no blood can get to the lungs to pick up the oxygen in the normal way. Basically, instead of 4 chambers that your heart normally has, mine only had 3 at birth. And they called me what was called a blue baby back then. Basically, I was born blue. So by the time I was 24 hours old, and spoiler alert, I did make it to the other hospital. Just trying to be funny. Please ignore me. I had 2 different procedures. Again, by the time I was 24 hours old, I had 2 different procedures. a heart catheterization, which is where they make a small incision in the growing area and place a small tube in the incision, then run the catheter through that tube and the blood vessels up to the heart. Back then, a heart cath was mostly used to diagnose CHDs, at least in the CHD world. But now, with medical advances, they can do all sorts of things with heart caths. It can be used for diagnosing heart problems still, or putting stents in, or even replacing valves, which is a huge step in the right direction. My very first one, though, was done to determine how severe my tetralogy of Fallot was, how severe my pulmonary atresia was, because again, they didn't know at that point. But once they had that information, they then did what was called a BT shunt, or a Blalock-Taussig shunt, which was done to help increase my blood flow temporarily, to help increase my oxygen levels. I was then in the hospital for roughly 21-ish days before I was able to go home. Now, my chances of survival that first year were very slim. Every time I would go to the doctor, my mom and my mama would get told, well, we'll see you in 3 months if she's still here. We'll see you in 6 months if she's still here. We'll see you in 9 months if she's still here. Once I did make it to my first birthday, my chances of survival did go up slightly, but they were still very low. And they still kept hearing that, we'll see you if she's still here. They really heard that until I was about 5 and I had my second open heart surgery. We'll get to that in a second. I have truly overcome so many obstacles due to my CHD, more than most people will ever deal with in their lives. And I dealt with most of it by the time I was 5 years old. So to say there's trauma there is an understatement. I have also had 4, open heart surgeries, as well as multiple heart caths. And then I did have another BT shunt surgery. I think my mom said I was around 18 months old when I had the second BT shunt surgery. The open hearts were to repair my TOF and replace my pulmonary valve. My first one was at the age of 4 years old. That one was to close the VSD, or the hole in my heart. Then at 5 is when I had that second open heart surgery, which allowed them to replace my pulmonary valve and shut off both my BT shunts. That improved my chances of survival to adulthood greatly. Still weren't great, but they were improved. And my mom and them finally stopped hearing, well, we'll see you if she's still here, which I'm sure they were very thankful for. At 16, I did have 2 more open heart surgeries. And you're probably wondering, why did you have 2 at 16? Well, let me tell you. One of them was to replace my pulmonary valve, and the other one was because I developed a blood clot behind my heart and fluid around my heart. This all happened within 5 days of each other. I went in on February 15th of 2001, to have my third open heart, but the first one of this little adventure. 5 days later, I was very sick. They were planning on letting me go home until my cardiologist took one look at me and said, no, I want her in echo immediately. And I was in an echo. Within 40 minutes of him saying that, I was back in the operating room. So I credit my cardiologist a lot for saving my life that day. That was what happened then. And it was very scary, very traumatic. And that's where my PTSD started. And that was just kind of like the beginning of everything that happened because of my CHD. Yeah, I'm sure you're probably asking, well, wasn't that enough? Hadn't you been through enough? Sadly, no, I hadn't. At 23, I began having chest pains and dizzy spells that would occasionally cause fainting. My cardiologist referred me for an EP study, or a electrophysiology study, which is used to identify the source of arrhythmias or determine future arrhythmias. Due to this EP study, I was diagnosed with ventricular tachycardia, and it was highly suggested that I undergo a procedure to have an ICD, or implantable cardioverter defibrillator, put in. This device is basically a pacemaker and defibrillator put together. And it would be there if my heart got too far out of rhythm, or if I needed to have my heart paced for any reason. Thankfully, I haven't actually needed it because of my arrhythmias. They correct themselves, and my heart doesn't need to be paced because my heart rate stays where it should. But it is there if I ever need it. I have had to have my ICD generator or battery changed. The generator is the battery, basically. That was once in 2014, and currently this generator that I have now is getting low on battery, so I will likely need to have that changed again soon. They do last anywhere from 5 to 10, 15 years, depending on what one you have. Now, 20 years ago or so, if I needed my pulmonary valve replaced, I would absolutely automatically need another open heart surgery. Thankfully, because of medical advances, in 2018, when I need to have my valve replaced again, I was able to have a Melody valve put in through a heart cath. And it was a much simpler procedure. I was in the hospital overnight, released the next day, and I was back to mostly normal within a week. It amazes me just how far medical advances have come since the 80s when I was born. And I am so very, very, very thankful for those. So I hope that gives you an idea of everything that I have gone through over the last 40 years. You may be wondering, though, how does this affect my everyday life? And right now, I'm going to be very honest with you. My heart, out of all of my disabilities, is really the least of my problems. And you're probably wondering, how on earth is that the case when you've dealt with it your whole life? I honestly think living with it my whole life is one of the reasons that I am able to cope with it the best. Now, don't get me wrong. I still have daily struggles such as heart palpitations, skip beats, shortness of breath, and mild chest pains. These are things that do occur daily, though the shortness of breath and mild chest pains aren't really something that happen daily. But the palpitations, the skipped beats, the arrhythmias, they absolutely do happen quite often, every single day. And other days, some days are worse than other days, is where I was going with that. And of course, that makes it difficult. I also can't breathe when it's really hot outside or when it's really cold because of my heart and because my lung capacity is diminished, and that is due to scar tissue from all of my surgeries and procedures. I did mention, and I didn't originally write this into the script for today because, yes, I write my scripts out. I will explain why in the next episode, but for now, just go with me. I didn't write this in, and I got to thinking about it a minute ago. You're probably wondering what some of the tests are that can be done to keep track of your CHDs. And there are a lot. I'm not going to go into a lot, but two of them, one is an EKG, and I cannot off the top of my head remember what that stands for. I will get back to you in a different episode. And one is an echocardiogram. The EKG is basically, neither one of them hurt. They put little stickers, kind of like just little stickers and wires on you, and it tracks your heart, like I think it's the electricity of your heart. Again, I will go into these in a little bit because my brain is being weird today and I can't think. An electrocardiogram is basically just an ultrasound on your heart. Don't worry, I am going to do a completely separate episode on all of the testing in a few weeks, so I will go into it more there. But the thing that really sticks with me about CHD and my life and all of that is there are studies, and some people do believe that there's a correlation between CHD and other health problems, other invisible disabilities. Fibromyalgia is one of those, as well as ADHD and a few others. Now, I don't have numbers because as far as I can tell, there are no official studies between CHD and fibro. However, I've talked to a lot of adult CHDers who also do have fibromyalgia. I can't say for sure if my CHD has caused my fibro, but it is a possibility. So next week, we will talk more about fibromyalgia. I hope that this has answered some questions for you. If not, please reach out to me with any questions you may have. Please reach out to me with any CHD stories you may have. If there is a particular defect you want me to shine a light on or bring awareness to, please also reach out to me. You can do that at livingbeyondtheinvisible@gmail.com or find me on Facebook and Instagram at Living Beyond the Invisible, and I will get those done for you at some point. Thank you for joining me today on this episode of Living Beyond the Invisible. I hope you found the insights and stories shared today helpful and inspiring. Remember, living with an invisible disability is a journey, and together we can navigate the challenges and celebrate the triumphs. If you enjoyed this episode, please subscribe, rate, and leave a review. Your support helps me reach more listeners and build a stronger community. Don't forget to follow me on Facebook and Instagram at Living Beyond the Invisible for updates and additional resources. Until next time, take care of yourself and keep living beyond the invisible.